number of years, and the previous government truly gave them the runaround. There's no better way to explain it. They went straight to the Premier and were given nothing but the runaround, and I was embarrassed that a government would have done that to a group that was trying to raise money, to send them to visit government agencies that clearly were not in a position to give them any funding at all. So it has been a struggle for them. They're again now at the period where they are questioning if this project's going to move forward. They have secured the money from ECBC, they have secured the money from the municipality, and local fundraising is going very well, with another major event being planned for mid-May. Right now, the only partner not at the table is the province, which is very unfortunate because everything else is in place. The minute that they hear from the province in a positive way, the project's ready to move forward. This is going to bring medical professionals under one roof. It's going to replace a very old facility, which used to be the old home where the nuns stayed, that they turned over to the community as a medical clinic. So could the minister today, as briefly as possible, just give me an indication of, are there still ongoing discussions about the province being a funding partner in the construction of the new W.B. Kingston Memorial Clinic in Lardwes?
I recognize the Minister of Health.
Thank you very much, Mr. Chair, and I'd like to tell the member that he can probably look forward to not having to ask me this question perhaps next year. A couple of things. I mean, better care sooner is very much about improving primary care, and about working with communities around their existing infrastructure and their existing healthcare providers' needs. And when you have a community like this one, who is in this situation and they've done all of this good work, it's almost like they have anticipated what the government's plan and priority was going to be. And although many of the CECs are focused on small community hospitals and working with those entities to bring them into a more modern healthcare era, the practice at a clinic or a community health center such as this one is also a part of that plan, even though it isn't a small community hospital. And so one of the things I've been concerned about is that we didn't seem to have in the department a real infrastructure program to support these kinds of standalone community health centers, but we are changing that. And so this particular community health center, we will work with this community health center, and I understand that correspondence came in to me very recently in the last couple of days, and I will have a chance to look at that, but we will attempt to do something in this fiscal year to bring this project to fruition and give that community a modern healthcare center and support the good work that they have done. So if your question is about the province being a partner, we will be a partner in this.
Recognize the honourable member for Richmond.
Well, I'm certainly pleased to hear that, and I certainly want to commend not only the minister, but I know that your deputy as well has been working very closely on this. And again, this is not a criticism of the existing government, because previous administrations have also not provided any infrastructure funding for these standalone clinics that weren't either attached to a hospital or part of a district health authority. So this is something new that's being requested, and I understand that there are other communities that have put proposals forward as well, that if there isn't a change in the policy, will not be eligible for any funding either. And what's frustrating is that when you have the federal government that sees this as a worthwhile investment, and yet the province is not at the table. That's what the community finds so frustrating. So I'm very pleased to hear that, and I believe the correspondence most recently sent to the minister was requesting a meeting. I know they're prepared to come up here in Halifax. I don't think they're looking for much time, but I think at this point they would like to hear the reassurances similar to what the minister has given today, and I do hope that we can find some time within the next week or so to try to bring them up here and find some time from the minister's busy schedule that she can meet with them, because I'm sure the minister knows and doesn't need me to say, these are volunteers. They are people who are giving freely of their time. They've done a tremendous amount of work. I believe it's fair to say that this has been ongoing for at least 4 years. That work has been done on this. So they're still hanging in there. Money is still coming in from different organizations that want to be a part of the fundraising effort. But right now the missing link is investment from the province. So I'm pleased to hear that, and we'll certainly, I'm more than happy to continue to work with the minister and the deputy to try to arrange a meeting as quickly as possible, and as well anything that I can do to assist in the efforts for the discussions that are taking place. We'll certainly be happy to do so. So with that, those are a couple of the issues I wanted to raise. I could go on at length about the caregiver programs and some of my concerns there, but I believe we will have an opportunity, both through question period and hopefully through other debates, to talk about some of those programs. The minister knows well my concerns, especially support for family caregivers, daughters, sons, sisters, those within the family that do provide care. And unfortunately, the new programs that are out again seem to exclude direct funding to family members, which is extremely unfortunate, because I know in my own community, caregivers are family. People don't want strangers. They don't want people other than their family. Asking for someone to care for you is a very private thing. I still have people that won't even take home care, even though they should, because they don't like the idea of a stranger coming into their home, and it's a matter of pride as well. So it's always a challenge. But when you see that programs come out and that family members are excluded, it is disheartening, and I do hope, I think the minister has indicated that these programs will change over time. I do hope that at one point that family members are eligible. As I've said before, for the most part, caregivers are females. They leave the workforce to care for loved ones, and now to be told that we respect you as a caregiver, but any financial incentives given will be given to others and not to you, I think is extremely unfortunate. And I do hope that the minister and her staff will continue to work on finding ways of supporting family members who leave the workforce and who give up everything basically to become caregivers for their loved ones. As I said, the minister has heard me go on about this at length before, and I do hope to see the day where family members will be eligible for these supports, and that those who are receiving care can pick their own caregivers, with family members not being excluded. But with that, I do want to thank the minister for her answers. I'm trying to think of any other health issues that I could get such positive answers about in Richmond County, but I will stop at the two very good news that we received today on St. Anne's and on the Kingston Clinic, and do appreciate the minister's responses on that. And I believe my colleague from Halifax, Clayton Park, our health critic, has some more questions. Thank you.
The Speaker of the Nova Scotia House of Assembly grants permission to record the televised proceedings of the legislature for use in schools and for other purposes, such as private study, research, review, or newspaper summary. Television and radio broadcasters may make use of recorded excerpts of the televised proceedings in their news or public affairs programs for the purposes of fair and accurate reports of proceedings. Program material may not be used for political party advertising, election campaigns, or any other politically partisan activity. Any other commercial use or rebroadcast of these televised proceedings requires the express written approval of the Speaker.